just got the Carbicide for you today. You're just having one tablet a day.
The PSA is really one of the key health leaders in the health system. We represent such a large group, the largest group of pharmacists in Australia, that we're out there, we're out in front and we're leading the change and positioning pharmacists as part of the healthcare team.
The pharmacist is a very accessible health professional. We're available to offer advice quickly, often much more available than a GP. We run longer hours than most GP clinics. Doctors diagnose, but we're the experts on drugs, and I think it's important that we reinforce that position in the healthcare system, and certainly we have the capacity to refer when it's important.
As a GP on a daily basis, I'd say 50–60% of my interactions will involve the pharmacist in one way, shape or form. The role of the pharmacist is a vital role in healthcare, both in the community setting and in the hospital setting. I currently chair the World Medical Association's Council, and people are looking to Australia not just in the way in which we do our professional work and our professional standards, but also in the way in which we are advancing the healthcare agenda into the future.
As a young pharmacist, it is very exciting, especially with all these changes. There will be new roles available, so there's more variation in what we can do, and to be able to work more with other health professionals is also very exciting. The PSA not only supports community pharmacists or hospital pharmacists, but they also support pharmacists in many other areas, such as myself. I'm doing my PhD, and they support early career pharmacists in research, and also support younger pharmacists to move into other areas as well.
I think a pharmacist's role in the health scene is changing dramatically. I don't work in a pharmacy, I work in a GP clinic with a variety of roles. My main role is not dispensing. A lot of my role revolves around the quality use of medicines for people. Each and every day I'm speaking with the GPs about medication use and involving their patients. I also speak frequently with the other allied health professionals and the community nurses and things like that as well, in terms of patient care and collaborative care really.
There's a shift in community pharmacy itself. Traditionally it was always a dispensing role, but now we're shifting much more into professional services. For me, mental health is probably my main area of interest, and I see pharmacists having many roles in that area that they either already do, or I think we should be training them to do more in that area. But also hopefully getting pharmacists outside the four walls of the community pharmacy as well, to utilise those skills outside as well.
There are a lot of specialist areas that pharmacists can concentrate their efforts in, that they can focus their time in, from HMRs to obesity treatments to diabetes, asthma. And really the opportunities are there for people to take up the slack and to decide to work in those areas and become specialists in those areas. My particular interest in pharmacy practice has always been in addiction medicine. And that started quite a long time ago when I realised that we probably have much more access to the patient than the doctor does. So whereas a doctor may see a patient that they're treating on a monthly basis, in the pharmacy we have the opportunity to see them sometimes on a daily basis. And what this does is it builds a feeling of trust, and if it's required, we can certainly feed back information to the doctor to close that loop and work closely with the doctor. But other times I find what's happening over the years, as confidence has been gained in my ability, I find that doctors often are referring patients to me.
People have got to step back and actually have a look at how their pharmacy is operating to incorporate these new services in a sustainable manner. And so it's a really important area that PSA is also working on, is around what we call changing practice. And we have a field officer team out there at the moment who will support those pharmacists who want to undergo that practice change initiative, so that a lot of the new services that are coming on board now can be picked up in a sustainable and meaningful way.
I think that pharmacists can feel very confident of the executive of the PSA, the team that's leading them forward at the moment. They've got a good team that will enable them to collaborate with medical organisations at a time when the health dollar is under real scrutiny and when we've got to work together.
This is an exciting time to be a pharmacist if you have the ability to look outside your comfort zone and to move into some of these initiatives. And there's a lot of initiatives out there. There's still silos, but you can be very proactive as a young pharmacist and work closely in some of these programs to get out there And one of the programs under the professional program initiatives is working with others, and you will be rewarded for trying to work in collaborative partnerships with others. And there's a list of 10 health professionals that you can be rewarded in a payment system if you actively go out there and work in your community with others to deliver health services.
It can be a bit challenging and daunting, but PSA will be there to support and facilitate younger pharmacists through these new roles.
I think that all health professionals benefit from being members of their health professional organisations, because they will provide them the guidance and support and backup when they most need it.
At the moment, it's an exciting time for pharmacists. We have major reforms being implemented by government, and it's about PSA helping pharmacists to be part of those reforms, to bring pharmacists into the healthcare team and to show people what we can do and what we can offer.
PSA's role is to make sure we're good enough to be at the table, to position pharmacists where they should be and use their expertise in the area of medicines to promote the wellbeing of consumers and patients out there.